Hello guys and welcome back to my YouTube channel. Today we are looking into another episode of Medical Grains, and today we are talking about a condition that you are born with called Prune Belly Syndrome. And I will tell you all about it, but first let me tell you that I am going to show pictures of babies that have this condition, so if babies that have deformities triggers you in any way, so please don't watch this video. And if you do a Google search for this condition on images, you will see pictures of live babies and also deceased ones. So if that will trigger you as well, then don't do any Google searches for that. But I will only be showing live babies pictures that I find on the internet in this video. Alright, let's get into it. So this condition is also known as Eagle-Barrett syndrome, and this is a condition where the baby is born with a partial or complete absence of the abdominal muscles. So along with not having any abdominal muscles, sometimes the babies can have issues with their testicles descending into the scrotum, and they're also going to have a lot of urinary tract malformations, and that's where most of the issues are going to stem from, is the urinary tract. So these issues include dilation of the ureters that drain the urine from the kidneys to the bladder, accumulation in the ureters or the kidneys, and they can even have backflow from the bladder into the ureters or the kidneys, which is going to cause damage. The cause of this is really not known. I'll speculate a few things later in the video, but there's really not like a known cause for why this happens. And it mostly happens in men. There are a few cases where women have had it, but it's pretty much always boys that are born with this condition. So as you can see in this picture here, babies are born with this wrinkly, prune-like skin over their stomach, which is why it's called Prune Belly Syndrome. And it's obviously very diagnosable, very noticeable. As soon as the baby's born, they'll see that and know what's going on. But it could be very startling for a new mother, I would assume. So the abdomen's going to be very large, very soft, and not, very lax. You might be able to see their intestines like through the skin because there's no muscle over it. Their belly button could just be like a vertical slit because there's really nothing like it's attaching to like muscle. In some cases, the belly button is actually connected to the bladder instead of to the stomach where it would normally connect. We'll also have chest issues where their ribs are more flared out instead of curved around. They could also have a depression in their chest, which is called a Harrison groove. I'll show a picture of that over here. But they can also have a pigeon chest as well. So now on to all the urinary symptoms that they're going to have. They can have an enlarged bladder, it could be very distended, they could be retaining, so then they would need catheterized to relieve. The ureters could be narrowed or closed off to the bladder, although they're usually dilated, but they could be partially dilated and partially narrowed depending on the condition. They can also develop hydronephrosis and cysts in the kidneys as well. So hydronephrosis is where they are retaining urine in the kidneys and it's not draining from the kidneys to the bladder, so that's going to cause kidney damage as well. There could be a urethral obstruction from the bladder out of the body. The testicles could be partially connected to different things in that region, which is why they aren't descending in the first place. So it really just depends on how much of the muscle is missing and when it started to be, how the baby was laying when it was starting to develop and all these things. There's lots of factors that go into how many complications can arise from this condition. About 20% of cases, the child will have club feet or club foot, which is where the bones in the feet just don't grow properly and they're very deformed, but it's only in about 20% of cases. And in about 10% of cases, they might have cardiovascular issues, but that's also rare. So there's two main theories on what causes this, and it's really like which came first, the chicken or the egg. The first theory is that the bladder doesn't form right, which then causes bladder distension, which then causes the abdominal muscles to form incorrectly. The other theory is that the abdominal muscles form incorrectly, which then causes the bladder and the ureters and the kidneys and the testicles and everything else to form incorrectly. So it's really just which one was formed incorrectly first. There are cases where multiple family members have this condition, so there may be a genetic component. They haven't really isolated that yet, they're still working on that. So treatment for this condition really depends on how severe the condition is for the patient. So some patients might have a few minor surgeries and then go on about their life and live a pretty much normal life, while other patients have to have many, many surgeries and transplants and things like that and revisions in order to live a somewhat normal life. One common surgery is a vesicostomy, which is where they take the bladder and bring it through the abdomen so that it can be relieved so that the person can pee normally. They might also do an orchoplexy, which is where they help the testicles come down into the scrotum like normally would. They might get a cystoplasty, which is a bladder reconstruction depending on how it's been deformed in the body. They might widen the urethra if that is also really constricted, which would prevent the patient from being able to urinate normally, so they might widen that if needed. One option that is being trialed is that they're augmenting the bladder muscles with muscles from the hip. So they'll take a portion of the hip muscles and surgically put it in the bladder somehow to help the bladder contract, so when the bladder is contracting and you're urinating, it empties fully, because a person who is retaining or not fully emptying their bladder is at high risk for infection, and a person with so many potential surgeries and already has kidney, bladder, ureter issues does not need any infections to go along with that. So it's important that the bladder fully empties when you do pee. A lot of patients may require a kidney transplant later in life, and it really just depends, as I keep saying, it just depends on the severity of your symptoms. So life expectancy is difficult with this condition because it really just depends on how bad your symptoms are. Some babies are not even, don't even make it out of the womb with this condition, unfortunately. It really, as I keep saying, just depends on how severe this condition is for the patient. Things like chronic kidney disease that develops from all the issues that they're having, they have a high risk for infection. They're also undergoing many surgeries, but puts them at higher risk for infections and other things that go along with having surgery, so that can also decrease their life expectancy. The only information I really found about anyone who's been diagnosed with this, and I couldn't even access the whole article without paying for it, it was written in 1977. So the article was about a 54-year-old man that was diagnosed with this condition. So this was written in 1977 and he was 54 at the time. So he was born in 20s, whatever's. He probably was maybe born in a hospital that maybe didn't know this condition, or it was such a mild case that no one caught it. Or maybe he wasn't even born in a hospital. Who knows? I don't know. It didn't say where he was, it just said this happened to him. So he didn't get diagnosed with this condition until he was 54 because his symptoms were so mild, and when they finally started to have symptoms that needed to be treated, they finally figured out what it was. But it doesn't say how long he lived after that. But as far as I can tell, he's the oldest person to ever been diagnosed with this condition, but it doesn't say anything else really about him. Anyway, so that is Prune Belly Syndrome. I hope you enjoyed these pictures. I think these babies are cute. I mean, they're a little, their tummies are a little weird, but whatever, they're still babies. They're still cute. I love babies. They're so cute. Anyway, thank you guys so much for watching. I really hope you enjoyed it. If you have any comments or questions, please leave them down below. I would love to hear them. And I will see you guys in the next one. Bye.